All right, we are here with Dr. Erin Hayford. She is a naturopathic doctor and a somatic experiencing practitioner who has a really unique mind body approach. So, Katie and I are really excited to ask Erin some questions because I think this is going to be really interesting, especially if you're struggling with chronic illness or know someone who is. So, Erin, to start off, seems like the results that you get with, working with people who have chronic illness are incredible. And from looking at your social media, Katie and I see that you say you're talking to the person's body. So to start off, what does that mean? What does it
Yeah.
mean when you're talking to someone's body?
Yeah. So I sort of slowly developed this approach over time. I honestly don't know when it started. So I don't have like a clear, like, I'm going to do, I'm going to start doing this way. But I, through naturopathic medicine, I think, we already have this sort of training in an understanding that the body has an innate capacity to heal. So there's like this innate wisdom that we are trained in to know exists. When I did my somatic experiencing training, that kind of took it to the next level because you're working more directly with the body and this idea that the body keeps the score and the body is holding on to memories and somatic memories, that kind of thing, trauma. So I feel like it's the combination of those two things that just sort of funneled me into this, like, what if I just talked directly to the illness and see what happens? I really do wish there was like a first time story where I was like, I just did it and it was amazing, but I don't have that. I don't know when it started or how. So essentially, what I will do, just to kind of give like a rough outline of how it looks or what that actually means in a session, I will guide someone into, kind of like a meditative state, do some things to like ground them, etc. Then it really truly, I just bring them right to like does your illness live? Where are your symptoms living? I think of it as like, where is your body talking to you? Like, what parts are talking through the language of symptoms? So, like, say someone has back pain, so they maybe go to the area of their low back, bring their attention there, and then I have them just get really clear on like, how big is it? How wide is it? How deep is it? What color is it? What texture is it? Like, using that kind of language gets us out of our logical mind of like, oh, it's back pain, it's a muscular issue, and gets us more into this language of the body, which is more through imagery and sensation. And doing that helps again to disengage from the logical brain. So we're more in this like, just, I don't know, it's in like a different communication. It's like a different language when we shift into that more right brained, I guess. I know that's not a thing anymore, right? We debunked the whole right brain, left brain thing, I think, but just to use that as an illustration purpose. But if we get into that more right brain approach of just feeling it and seeing it and sensing it through that different way, that seems to open up a channel of communication with the body that is now different. And so once a person kind of gets into that mindset and they're describing their symptoms or their illness from that perspective, then I say, okay, let's now ask the body, like literally like talk to this part of your body that we've now identified and kind of see it through this different lens. And I will usually throw out the first question of like, what is your purpose? What are you wanting me to understand? What are you holding? I mean, I go right for the big guns, like in question one, and just kind of see what comes up. I truly have never worked with anyone where they were like, nothing is coming up, or sometimes it's not like, sometimes they don't get a direct answer of like, I'm holding the trauma experience from this age. It might be like, okay, well, I'm not quite sure, but I'm getting this sense of like a lot of fear, or I feel really uncomfortable, or for some reason I am like seeing this like room in my house or whatever, right? Like it's not always a
Yeah.
direct answer, but something comes up. And so whatever comes up, we take it and we work with it from there. And it really is just this process of helping to understand kind of like what the question is asking, like, what is the body holding? And that opens this door into changing how we think about illness, in that it's like, okay, it's not the muscle is pulled and that's why my back hurts. Sure, that's part of it. A pulled muscle doesn't feel good, but like, what's beneath that? Like, what is beneath that pulled muscle? Why is it chronically hurting? Why is nothing helping it? There's something there that's keeping it kind of stuck there. So what is that? And that's what this communication thing opens up for us.
Okay, so you're asking their body a question, they're giving you an answer, and then do you kind of interpret that and decide what to do next?
Yeah, so I really think of myself as the just like a guide. Like I have my own maybe like intuitive impressions or ideas about what might be happening, but I'm very careful not to put any of that on the person, because it's so
Sure.
much more powerful when their own interpretation or ideas come forward. And sometimes I'm not right, so there's that too. So yes. So for example, let's say I say like, what is your purpose? And the person will sit with their low back and then they'll be like, well, it feels like there's something about like fear here or something like that. And I'll say, okay, let's sit with fear. Like, where are you feeling that fear in your body? How does that show up? What is, what, like kind of the same thing we did with the back, but now with fear. So we just like take whatever they say and just take it to the next step. And I just kind of, yeah, direct it like based on what they say, like, okay, where do we go with this? Where do we go with this? Where do we go with this? And eventually it gets us to some core stuff, like a core belief about themselves, a core memory and experience. And that really gets us into that really specific thing that the body is holding. I always say that like a lot of us know our history, our stressors, our traumas, our challenges that we've had in life. So we can be like, well, I feel like this back thing started when I went through a divorce. So we have this thing in our head of like, okay, I know it's probably related to that. But when we do the work that I do with people, we get the like nitty gritty specific thing that the back is holding. So generally it might be the divorce, but like just knowing that doesn't really give you much to work with. But if you do this work and get to like, oh, it's this feeling of like I don't deserve love and support, then you have a very specific story to work with. And then I have a process from there that we kind of use to help a person heal and release that story so that the back doesn't have to hold it anymore. Does that make sense?
Yeah. Yeah, absolutely.
Yeah.
So it sounds like kind of like everything has an emotional root cause, these physical symptoms.
Yeah. That's my opinion. Yes.
Okay. Yeah, that's not the first time I've heard that. I think that that's really cool, and I have some questions about the somatic experiencing training because I looked into that at one point. It seems really long.
It
How
is.
long how long did it take you?
Yeah, I mean it's 3 years. It's the reason it's so long, the like actual coursework itself is how many? It's like eight different weekends spread over 3 years.
Okay.
But the reason they don't just do it like, bang it out over the course of a year is because in between you have to do a lot of work like getting your own sessions done, doing case consults. Like they want you to really experience it for yourself, and then you're taking the people you're working with and going and having consultations around that to really make sure you're getting the material, like you're understanding it basically. So yeah, it's a long process because there's a lot of hands-on kind of work in between the actual learning part, but you should
Yeah.
do it. It's awesome.
Yeah. No, I looked into it and I think it was just like, oh my gosh, I'm not sure that I have time to fully commit to all of that yet. I ended up deciding to specialize in treating OCD. So I do exposure therapy with people,
Nice.
which is very cool. But I do a lot of the times in sessions with my clients find like, okay, you're holding this in your body and it's very evident that you're holding it in your body and you're feeling it. And so, yeah, I mean, that is for anyone who's skeptical, that it really is a real thing.
Yeah,
Your body remembers everything that's happened to you, even if you don't.
correct. Yes. Yeah, and just to kind of go off of that too, I think of things like OCD, depression, even if it's a mental health kind of rooted thing, it's still a symptom. It's still something that the body is producing or doing or responding in a certain way. So this work is, I work with people who have depression all the time or anxiety all the time. It's not just chronic illness in a physical sense. So yeah, like I think that's part of when I was practicing more as a traditional naturopath, where I kept getting to this point of like, I feel like I'm not going deep enough. Like I get that you have a thyroid issue and I get that you have gut issues and I get that you have, and here's some like herbs and things you can do. But there was always that feeling of like, it's not getting me to where I want to go with people. And so I was always interested in mind body medicine. I was always like taking all the extra courses on that. And like, that was always a part of my interest, but for whatever reason, I didn't allow myself to do it like clinically until after I don't know how many years of practicing kind of as a, again, traditional naturopath, where I was like, okay, screw it. Like I want to do mind body work because I feel sort of dissatisfied with, not that people weren't feeling better, but they were feeling better chronically having to do something to manage their body. And so I was like, that's it, it helps and they feel great. And a lot of people were fine with that. But for me personally, I wanted to go deeper and get into those deeper layers of like, but why is it actually here? Not just because on that physical plane of like, again, oh, it's because your muscle is chronically upset, or oh, it's because your thyroid is chronically suppressed or whatever. To me, in my mind, I'm like, but the body has an innate capacity to heal. So why isn't it healing? Like what is blocking that? And that's where my work took me into this place that I am now.
Yeah, that's super neat. And I noticed a lot of your messaging was about meeting the body where it's at and letting the body express itself and moving with it instead of suppressing it. And so I'm
Yes.
curious, do you feel like, so with like anxiety, for example, is there ever a time to calm the body and like kind of still quiet it and also listen? Or do you feel like, if we're always talking to the body, then we don't need to really be ever suppressing anything?
Right. Yeah, that's a great question. I I could answer this. I guess there's two ways to think about it. Like I am not opposed to symptom management or medications or anything like that because I think definitely there's a point where symptoms are so uncomfortable, they just get in the way of life. Like we can't get out of bed or we just can't function because symptoms are so intense. And so I think everyone I am working with currently, maybe with like one or two exceptions, they are taking medications of some kind. And, some of them are heavy hitters. Like I have several cancer patients who are on chemo and radiation. The medications do not get in the way of the work. And so I am all about, yes, kind of like meeting the body exactly where it's at and trying to. I think a big part of this work is around acceptance and allowance because and this is where it gets tricky because a lot of medications are about kind of non-acceptance, right? It's like, I can't accept this for what it is. I need to quiet it. I need to get rid of it. So for me, it's not either or, it's both and. It's saying, I accept that this is here. I accept that it sucks and it hurts and I hate it. And so therefore, I'm going to take some medication to have some relief. And I also accept that there's this other thing going on here to like meet it on that level of like, I'm not going to just like silence it and ignore it and push it away and move on with my life. I'm going to take something if I need to like find some relief and then do this other work to really acknowledge it. Because I think really to me, that's what symptoms and illness is. It's the way that the body's like, hello, pay attention, tune in. Like I've got something here. I can't do it on my own.
Yeah.
Something is blocking your innate healing capacity. That's what a symptom is. It's saying this thing is here. Your body can't get past it. It
Mm.
needs you to take over. So if we're just like, yeah, I don't know. I think they're like the other side of that spectrum is like spiritual bypassing of like, pain is okay. Like I'm fine. Everything's fine. I can deal with this. Pain is part of life. Like, like we can go to this other end of
Yeah.
just like overriding it in that capacity. So it's this like meeting it in exactly where it's at of saying like, this is what it is. This is what it's doing. I do what I need to do to manage it. And I accept that it's here for this bigger reason. Does that answer your question? Does that make sense?
It does. Yeah. As you were talking, I was thinking through like different examples of chronic illness. And like, I'm curious. Okay. So, with something where there's like an actual infection, like if there's Lyme or something, then if it gets to the point where someone's having chronic symptoms, then that's the body speaking up saying, I need help. I can't do this on my own.
Mhm.
And so, would it be usually an emotional block and then getting past that, you find people get relief? Or do you ever see the body speaking up because it wants help in the form of like outside herbs and medications as well?
Yeah, good point. I, well, I was about to say I haven't seen the latter thing before, meaning like the body wanting outside support. I think what it comes down to is the body, the reason the illness is there is because there's some like, emotional need not being met. There's some story, there's some limiting belief, there's some traumatic experience that the body is holding. So at the core, it is always emotional, or there's some sort of rupture in our way of attaching or being in the world or in relationship or feeling safe. So it always does come down to that. However, sometimes what that thing is requires us to take medication. So let me explain that. I'm working with someone right now. Again, she has cancer and her like it's so interesting. Sometimes illness is super metaphorical. Like it like represents exactly what the body's holding. Not always, but so in her case, she has a tumor and her kind of persona is tumor like, where she has closed herself off from the world. She's acting very autonomously. Like, tumors are cells that are just doing their own thing, right? They're just multiplying. They're not following any sort of rules of the body. So she's sort of had like emotionally, personally had walled herself off from the world and was like, I'll just do things my way because I can't trust or rely on anything else around me. This was like part of her trauma story. And so we uncovered that through talking to her tumor. And then the thing that her tumor therefore needed, or her body therefore needed, was the capacity to trust and to rely on outside stuff, basically, to like let something help her, to let something in, so that she didn't have this story of like, I can only trust myself, I can only rely on myself. And that's actually what led her to needing chemotherapeutic agents, to trust them to like help her, because she can't do it on her own. And so, the drug, obviously the specific drug comes down to like the specific cancer, but it was not so much the drug that her body was like, oh, we need this specific thing. It was more that we need you to trust something external to come into your body, and it's a medication, to like get out of its way, let it do its thing, and let it show you that you can trust and rely on other things to help you. So that's the way that I've seen that show up, if that makes sense. I mean, for sure, there are like nutrient deficiencies and, things like that that we need. I think what I have seen, though, is that it's more so the mind, body, mental, emotional thing that the body's holding, that it's asking us to therefore then go out into the world and find whatever that is to help things shift. And sometimes it's medication, but more on that mental, emotional plane versus physical. Does that make sense?
Yeah, that's super neat. Wow. That's a really neat example of
Yeah.
wow.
Yeah, that
How
was
did
last week. It
you
like blew my mind.
That is crazy. How did you get into all of this? Like what made you choose to go to a naturopathic medicine school?
Yeah. Yeah. So it started with my own health journey, which I'm sure is true for many of us. So my whole life I had stomach stuff. Like that was my body part of choice that would always talk to me if stuff was happening. So my gut, yeah, I just had like chronic stomach aches, chronic stomach stuff my whole life. The story was like, oh, that's just, our family just has stomach problems. Like I just assumed that was just normal. But when I turned like 2021, it was no longer just a stomach ache, and it was obviously something much worse. Like I got very, very, very sick. I had to drop out of college. I felt very lost, like a lot of things were happening, and ended up getting diagnosed with something called Crohn's disease. So for people who don't know, it's an autoimmune condition that impacts the gut. And so basically my immune system was attacking my gut, causing tons of inflammation, a lot of pain, a lot of bleeding. It wasn't absorbing any nutrients because my gut was too inflamed to like do what it needed to do. It was awful. And, so yeah, I was spending like my 20-year-old, 21-year-old years like getting colonoscopies and laying in bed. And like my friends were like partying and going to college. I was like, okay. So, for me, that was like my wake up call, right? It was like something is clearly not okay and I can't ignore it anymore, which was sort of my MO of like, I'm fine. Don't worry about me. Don't, look over there, whatever, like just total avoidance of that kind of thing. So my body was like, okay, no, you can't do that anymore. So here's this illness to stop you in your tracks. Interestingly, because of that, and, I think, again, looking back, it's no coincidence. Like, this is why I think of illness as sacred. My whole like phrasing I use is sacred illness, because it was because I got sick that I then was like, okay, well, I guess I'll start studying nutrition, because it's my gut. So it must be like food, I must need to like eat differently or something. And actually, I asked my gastroenterologist, like, what should I be eating? Because it's my gut. And he was like, oh, don't worry about that. Just take your medication. And that was my first little, like, that doesn't
Mm,
seem right. Like I spent my whole life in the conventional medical world. So I had no concept for alternative anything. But him saying that, like my brain, something was just like, that's not right. That can't be right. So I decided to go to school for nutrition. So I started studying nutrition. And from there, it just sort of like opened up for me. So, like, kind of like what I was saying with practicing as a naturopath, it just didn't feel like enough. I was like, something's missing, something's missing. And that was the same for my healing journey, where I was like, okay, nutrition is helpful, but something's missing. So then I went on and studied herbal medicine. And I lived in Maine. That's where I grew up, flew cross country, went to Bastyr University in Seattle for the herbal medicine program. And in that school is where I learned about naturopathic medicine. So I was like, okay, well, I'm going to go all the way. So I started studying naturopathic medicine. And again, like everything I was doing was like, okay, this helps. This makes sense. Like I was getting more information, getting deeper and deeper and deeper. But still, I was like, what am I not? I'm still sick. Like I feel better, but I'm not where I want to be. And I had it in my mind for some reason, like, I'm not going to be sick, even though I was told like Crohn's is incurable and you will always have this and you will always have to manage it. My brain was like, no, I don't think so. No reason for me to think that, other than I guess I'm stubborn. I don't know. So then while I was at Bastyr, I learned about mind body medicine, there was something called biofeedback course or elective I could take. So I started studying that. And that's when, like, I don't know what, it's like that thing when like something just feels so right and you don't quite know why. And I was like, this is it. Like, I don't know why, but this is something. So I was doing that. And then it was through therapy that I learned that I had experienced childhood trauma, which, yeah, I feel like trauma is one of those things where like, maybe not always, but a lot of times when we have, whatever, challenging childhoods, but they're not the worst thing ever, you just assume this is normal. But when I started going through therapy, I was like, oh, that wasn't normal, or this isn't normal, or this way of thinking wasn't normal, or whatever. So then as I did that process and I studied more and more mind body medicine, that's when I started to really understand like what my body was holding. And I think about it now because I didn't really have at that time, I didn't really connect the two. Like I just was working on my trauma and I was healing that and I was changing how I was showing up in the world. And as I was doing that, my body started to heal. And so looking back, I'm like, oh, okay, well, there we go. Like I understand now why that happened. So I guess that's maybe something to point out too, is we don't always have to like directly talk to the body in order to heal it. For me, doing the trauma work I did was enough. But that, like, as I progressed on and did more mind body training, I was like, oh, that's what was going on. Like, that's what my body was healing and holding. And so it was working with a business coach who was like, your story is incredible. Like, this should be part of what you do, And so that's where I started to really connect the dots of like, okay, I want to work with chronic illness and this mind body piece because it worked for me. Like I'm living proof. I no longer like identify with having Crohn's disease. I don't have symptoms. I don't have to do anything to manage it. That's not always the case with people who do this work. So just to throw that out there too. But I think I'm one part of the, I guess, case file of people who can like fully recover and heal because I did. So that's really what drove me to say there's something to this. What did I do? What did I uncover? So I like wrote out my whole process, and that's now how I teach people and what led me to developing this methodology, I guess you could say, that I do now.
That's amazing. That's
Yeah.
so funny because I got diagnosed with Crohn's when I was like 14, and that
Whoa.
was what the hospital nutritionist told me. She was like, what you eat doesn't matter. Like, she told me she actually prescribed me to go eat a McDonald's hamburger and milkshake every day to get my weight up because I was so
What? Oh,
malnourished.
God.
Yes. Because she's like, you just need calories. Like, you just need more calories. And I was like, but I can't have dairy. And she's like, no, 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 it's fine. And
Oh
like,
my gosh.
so
Yeah.
I totally resonate with your journey. And what I think is really neat too is I feel like a lot of people, a lot of practitioners who do deeper work than just what's taught in school often came about it. Like you went to therapy on your own and kind of worked through your trauma on your own. And then now it sounds like you're able to offer a system that it's probably even quicker for people than what you went through because you were able to distill it and look at it with a bird eye lens and you had
Yes.
gone through it. Yeah.
That's how I like to think of it. Cause for me, all told, it was like 20 years from, well, not totally, because I'm 40 now. So 20 when I got diagnosed, I'm 40 now. I started the program that I do now probably 5 years ago. So like 15 years, all told, I guess, from start to finish that I figured out what I did and how to help people. So yeah, I'm like, let me speed this up for you a little bit because I guess the other thing I say too is like, I don't know if when I was diagnosed with Crohn's, if I had met, me doing what I do, if I would have like immediately signed up. I think sometimes we do need to go through these different journeys and I think the physical piece has a part, right? Like figuring out what my body wants for food and figuring out how to take care of myself on that physical plane, I think is definitely part of it. So I don't think it's like we want to skip that part necessarily, but I think really, as I had said to you guys before we hit record, my goal is just to change the mindset around what is chronic illness about in the first place, because that's at the core, I think, of my journey. I had no words for it, but there was that feeling I had in my mind of like, this isn't it for me. Like, I'm not going to be just someone who's managing illness for my entire life. And I think so many people have that feeling of like, there's got to be more to, or I mean, it might just be like a hope of like, God, I hope this isn't just what life is about. But I think there's this like, I don't know. I mean, we are born intuitively connected to our bodies, and that communication is there when we're babies, like there's a clear correlation between like my body's feeling this and I'm expressing this. And
Yeah.
then we start to lose that thanks to life and the programming we all have to override our body's needs in order to like conform and fit into whatever. So I feel like there's that innate wisdom, innate knowing, innate connection to ourselves that we have. And so when we get sick, I feel like there's, I don't know, so many people I talk to are like, I just knew there was something more to this. I knew it couldn't just be this. So that's my goal, is to not say like, you have to immediately go into this like talking to your body thing. But I just want people to have this mindset of like, this sucks and I need to figure out how to manage it on a physical level for sure. But I want to expand that mindset of like, and this actually, there's something bigger here for me. And, this is, I think, one of the hard pills to swallow of the stuff that I talk about, which is trying to almost see it through this lens of like excitement, dare I say, because it's this like invitation of saying like, there's something here that's blocking you from being more you, from like having a richer life, a more full life, a more aligned life of who you really are. When I think about my Crohn's disease, it was keeping me really like what I was doing, how I was showing up in my life. I was really small. I was a people pleaser. I was whoever people needed me to be. I was saying yes to things I absolutely should have said no to, all the things people pleasers do, which I think we now understand is the fawn response. It's like that, just like,
Mhm.
how do I placate and make everyone happy so that I am safe? And so I was holding all this tension in my body just chronically, constantly. And I had no clue who I was, right? Like I said, when I was sick, I dropped out of school, but like, I don't like, I was going to school for all these random things. I had gone to like 4 colleges by that point. I was like, I don't know who I am. I don't know what to do. I have no concept of self because I've always just been whoever everyone else wanted me to be. And my illness was like, okay, let's fix this. Like, let me stop you in your tracks. Like, let's pause and get you on the track of like you figuring out who you are, finding yourself. So I think of my illness as the thing that saved me, which is crazy, I guess, to say out loud. But for anyone who's done this journey, a lot of people can understand that in retrospect. Like, it's what opened up my entire life to being what it is now, which I'm so grateful for. I love what I do and I love this work that I do. And I can't imagine who I would be or what I would be doing had I not gotten sick. So to me, people who get sick are people who are being asked to step into something bigger. And it doesn't have to be like, now you must be president, God forbid. I think it's more about like, now you must be yourself, like the world needs you. And that might just be like sitting on the beach painting watercolors. It doesn't have to be this grandiose thing. There's just something about you that your illness is asking you to become. And so anyways, I don't know how I got onto that, but that's to me, like, that's the ultimate thing for me about what illness is about and what I want people to start understanding about when they get sick. Like, you can hate it and it's not both and, right? You can hate it and just know there's something bigger here for you than what meets the eye.
Yeah,
Both
I say
and.
that to my clients a lot. Like, hey, two things can be true at the
Yes.
same time, and they can be very, very different things, and that doesn't mean they're not both true. One of the things that I think makes the way you work so powerful is that it it empowers your patient or your client to be like, okay, so I have this thing that's impacting my life, but instead of just going to doctor after doctor and them telling me, hey, do this or hey, do that, or you're not going to get any better,
Mm-hmm.
it allows them to do something for themselves and listen to their body and take action on that. And I think that's really an important part of healing, is being able to like take part in your own healing versus just getting handed pills and going to appointments and having people tell you what to do.
Totally. Yeah, exactly. It's that, yeah, it's moving from a place of like helplessness, hopelessness into, yeah, and it's not that like you have to do it all yourself thing. It's that you can connect to the wisdom of your body and understand what it's asking of you, and then from there you can advocate more clearly, kind of knowing what it needs. Yeah, because I can't tell you how many times people have started doing this work and then realize like, oh, my doctor is completely misaligned, with like what my body needs me to do or the direction I'm going in or whatever that is. Yeah, it's kind of like taking that power back and not doing what my other client was doing and like walling yourself off from the world and being like, only I can do this. I must carry this myself. It's saying, what does your body need? Like, what is the medicine that your body's asking for? So then you can more clearly understand what to pursue, essentially. Sometimes that is like you need to stop relying on other people. And sometimes it's like you've got to start relying on other people. So it's very unique to people's, illness. But I think that's the thing. It's like find your unique kind of why for it. And then from there, specifically, yeah, you're empowered to like take the reins back Because I think, yeah, for sure, illness makes us feel very powerless. It's like, oh my God, my body is failing. I can't get out of bed. I can't do all the things I used to do. It's interesting because it's this like both and, like, it is like a death of self, like life as we know it can end and things can change dramatically. And that can feel very helpless and hopeless and powerless. But I think it's very much about, like, because of that, that's where we can start to reclaim and take things back and say, okay, so how do I build from here to make it my life? How, like, where do things need to shift and change? And how do I start to curate this so it actually is mine to hold, I guess.
That's beautiful. Yeah. It seems like on the other side of all this work, there's a lot of peace and just like probably just feeling more fulfilled and happier in life. And I also see people, I feel like almost hesitant to step into ownership and control and feeling like they can influence things because there's this idea that that means it's their fault that they've been sick and
Yes.
something they could have done. What are your thoughts of, like, how do you address that, or what do you think about this idea that, a lot of people feel like, oh, that means it's my fault if it's something I can influence?
Totally. Yes. Thank you for asking that. And I think that's probably the number one pushback I get about this work because, yeah, like it can feel very offensive to be like, your body is holding you're holding emotions in, or it's yeah, like it can come across as like, it's your fault that you're not expressing your anger. That's why you got sick.
Right.
And so, yeah, I'm very mindful of that narrative. And I'm grateful for people like Gabor Mate talks about this. And what other book? There's this book called Cured by a guy. He's a doctor, psychiatrist. I think his name is Jeffrey Ridiger. He talks about it as well. Highly recommend that book. It's very, very good. But both, yeah. So I'm like, okay, we're not alone in this, right? Like, I think that's a very common response to anything mind body is you're saying it's people's fault. How dare you? Which is understandable. So the way I talk about it is, first of all, the things that you're holding in your body are not your fault because you didn't traumatize yourself, right? Like, you came into the world a helpless baby who was 100% reliant upon everyone around you and the environment around you. You didn't get to choose the environment. You didn't get to choose your parents. You didn't get to choose your community. And we are heavily, heavily programmed and conditioned from even when we're in utero, depending on what's happening with our mom and her cortisol and what's kind of flowing through us as babies in utero starts to influence us and program us. And it starts to influence our brain and how our brain functions. And this is all, this is not woo. I like to anchor all of this into like neuroscience, brain training program. Like, it's very understandable. It's cause and effect. Like, if you are surrounded by chaos and stress, your brain is starting to program the world is not safe. I need to be ready to respond. And if I cry and I get hit, I shouldn't cry. So I should stop crying. And if I get mad and I get yelled at, I shouldn't get mad. Right. Like, I think of it as like cause and effect, right? We're just little cause and effect machines. And the majority of this programming is happening. Last I checked, the idea is between the ages of 0 and 7 is like the most heavily programmable ages. Think about from ages 0, like we have no capacity to control anything from those ages. I have a 5-year-old, like he has no capacity. He's like completely reliant on my husband and I, poor guy. So I think I always take people back to that of like, could you as a 6-year-old like make autonomous adult decisions and rationalize like, oh, they're just dysregulated, that's why they're being that way, it's not my fault. Like, we don't have that capacity. Everything when we're kids, we take it personally. We're like, okay, they're responding like that, it must be something I did. I must be bad. This must be wrong. This thing I'm feeling in my body must be inappropriate. How do I change myself to stay safe, to ensure that I get my needs met, so that I continue to have shelter and food and love? And, this is all very much like more of that unconscious mind that's all about survival. It cause and effect. It's like, what do we do that gets us hurt? What do we do that gets us help and safety? Do that thing. No matter what it is, do that thing. So that's what I always like to anchor people into, is like, we had no say over that. And, that we don't know that those things happened. Like, we're not consciously aware when we turn 25 of like, oh, I've been suppressing my anger because I was punished for it. So now at 25, I'm just going to stop. Like, it becomes just part of the fabric of who we are. And it's this like autopilot way of being. That's why somatic work is so powerful, because it's very much about accessing that subconscious mind. Again, like I was saying before, like consciously we can say, oh yeah, I had parents who like hated when I got mad, and I know that was detrimental for me. but that doesn't impact our subconscious programming. Our subconscious mind is very survival based. And it's going to say like, cool, I'm glad you recognize that, but I'm not going to just start expressing anger because that's terrifying. And we're not going to just start like getting hurt again. And so
Mhm.
it takes work to undo that programming and to change the way our nervous system and our mind is working. And so that's the part where, yeah, to counter people saying it's your fault, it's like, no, you didn't choose those circumstances. And also, this is basic neuroscience where you can't just decide to change. It takes much more than just a conscious choice to be different. That's part of it for sure. Like making conscious decisions to change helps. But that deeper subconscious body programming is the core of what holds on to that program that we received. And it takes some work to feel safe in letting that go and changing those patterns and stepping into who we are. So
Yeah.
that's a long-winded answer, but that's how I would frame that to people to help them understand, like, you didn't choose this and now it is safe. I always think of that too. Like when illness starts to show up, it's kind of this sign of like, it's safe now for you to start to let that programming go. And illness is your doorway into understanding what that programming is so that you can now have a better life, essentially.
Yeah, that sounds kind of like how people, they're like saving their whole year of PTO to go on this vacation, and then the body is like, ah, it's a break and gets
Yeah,
sick when it's safe. So like
exactly.
you have the flu on your vacation.
Yep, exactly. Or like getting sick on spring break after finals week or something like that. Yeah. The
Yes,
body's like, okay, now
exactly.
you're safe. Let's show you everything you've been holding.
Yes, yes.
Yeah. And I've noticed even just with my clients, like, especially ones with OCD, they'll say, like, why is my brain broken?
Mm,
Why, like, what's wrong with me? Why do I react this way? And I'm always telling them, like, your brain is just trying to keep you safe. It wants
yep,
you to feel safe, and so it's come up with these things that you have to do. And that's not the most productive way to keep you safe, but your brain's not broken. It's just trying to keep you safe in a not very productive way.
exactly. Yes. And that's such a big key piece of the acceptance thing I talk about. Cause it's like, you're like, I think I always think of it as seeing it as like your body is always, your mind, your brain, and your body are always acting on your behalf. Like they're always doing what is in your best interest to keep you alive based on the information that's been given.
Yep.
Like our mind and our body literally have one goal, which is to keep us alive. And so even though it can feel maladaptive or harmful, obviously illness doesn't feel like, oh, how is that keeping me safe? Like it sucks. And it's actually things like not working, but it's the body like doing what it can with what it's been given to ensure our survival, even if sometimes that means, yeah, like having a behavior or a symptom that hurts and sucks and gets in the way of things. It's like, well, okay, better that than you losing, your safety connection to this person, which provides your basic needs for survival. It's like running on this old programming saying that like you doing this behavior leads to your safety being cut off or whatever. And so, yeah, better you do this than that kind of thing. And so I always think about framing it through that lens of accepting that even though it seems wrong or weird or bad or like not the best choice to the nervous system and the mind and the body, it is the best choice because the alternative was way worse. Even though our conscious adult mind might not think so, that's not the mind that got programmed with that in the first place.
Yeah.
That's super neat. I like that a lot.
Mm-hmm.
And I'm curious. So I focus a lot on mast cell, and I saw your post on mast cell on Instagram and I really liked it. And I think you shared an example of a woman who had a lot of rage about growing up in this oppressive system, this patriarchal system that didn't let her, express herself and be herself. And so if it's something, do you feel like illness starts to pull back when someone just acknowledges what the underlying driver is, or because we continue to live in a patriarchal capitalistic society where some people are going to continue to experience their nervous system experiences the world as a threat ongoing? What do you do when it's active and continuing like that?
Totally. Yeah. I mean, in that this is something that I have discussed at length with folks on my podcast too, because we get to this point of like, we can only do so much on an individual level. And then, we're hitting this glass ceiling of society essentially in these oppressive systems that exist. So I think I've seen both. I've seen both. I've seen, like in my case, for example, and other people I've worked with, it was acknowledging what the body was holding that started getting symptoms to shift. In this client's case that you're referencing, so this is a client who has MCAS, which is mast cell activation syndrome, like you said. And so for folks who don't know what that is, it's basically when your mast cells are dumping histamine into the body, like in large amounts, and like reacting to kind of like everything that comes in the body. This is an immune response. So the body's like, oh, you just breathed in pollen, let's attack it. Oh, you just touched this like cloth, let's attack it. It's like everything that the body's that's coming into the body that feels foreign. The body's like, let's deal with it, in this like big way. And so in her case, what I'm seeing is it's not enough to just acknowledge it. Like, I think her body is like, great, but you actually need to like start to release some of this like anger and angst and actually start to do the work that we're asking you to do. And I think part of what that can be for folks is it's not so much about what we're doing. It's more about this like internal agreement we have with our illness, where we're like, you need to start to shift first, and then I'll do the thing that you're asking of me. Whereas if we're saying, okay, I hear it, I hear what you're saying, and we start to like change our mentality and take ownership of it and start to take the steps toward it, then the body can start to let go. And the way I don't know if that makes sense, but the way I think of this is I think of like illness and symptoms as the body has been doing a job for us. So it's been holding on to something for us, it's been managing it for us, it's been learning how to make sense of it for us, keeping it safe for us, etc. And so what it's asking of us essentially is like, can you take over the job? Like, can you fire us, put us out of work and do it for us? So whether that's like, again, expressing anger, or in this person's case, and this is where it gets woo too, like she came into the world having this in her, like she came into the world like hating men and like ready to fight any sort of like injustice, or like, anytime she saw any sort of unfair, like even from her grandfather or from her father, she would just like fight them. And so she came into this world like ready to tear that stuff down. And so yeah, so she came kind of like pre-programmed for that. But our illness is saying like, can you take over this job? And so if we start to, again, like kind of, it's almost like if we like accept, if we like accept the job and we like sign the contract to take the work over, the body can start to be like, okay, we can like start to let it go because we know you're going to do this. In her case, it's not enough to just cognitively acknowledge what's going on, because there's still a lot of resistance in her to actually take those steps. Understandably, like she doesn't know what it looks like or what to do, and there's a lot of fear. So I think that's it. It's that kind of like there's a slight but big difference in that, if that makes sense. Like for me, when I understood, oh, I'm being a people pleaser, and I'm, like when I started to make the changes where I would set boundaries and whatever, like I wasn't fully stepping into myself, but I was starting to like take the job. And so I think again, it's that like there's a pivot there of like, it's one thing to understand it. It's another thing to start to take those steps toward becoming the person your illness is asking you to become. That's kind of my question of like, who is your illness asking you to become? Number one step is to figure out like, who is that person? But then the bigger thing is to actually start to become that person. And that's oftentimes very terrifying. And so there's a lot there that needs to happen in order to like kind of clear the path so that you feel safe in taking those steps. But does that answer your question? Does that make sense how I'm explaining that?
Yeah, it does. It's really interesting. And I've thought about this. So again, I'm curious your thoughts on this, but do you feel like on a personal level, we come in with a soul mission and our body is directing us to follow that? Or do you feel like it's just whatever your body wants for you to feel safe? Or what do you feel like the driver is behind it?
Yeah. So one of the big things, sorry, one of the big things for me that kickstarted my journey, I don't know where it fell in line. I think it became like a confirmation for the path that I was on. I did a medical astrology reading, highly recommend, and I can give you guys the guy's names too if you want. But
That sounds cool.
Yeah, we want to do it.
Yeah.
he's mind blowing. He's in Seattle, and I like took some classes with him. Every reading I've had with him, I'm just like, what just happened? Anyways, so I did a medical astrology reading, and one of the first things he said to me was like, I'm looking at your birth chart and I can see like, all the things that happened with your parents are sort of like described by your chart. Like everything that, you were traumatized by is sort of described by your chart. Like, yeah. So that for me was this confirmation of like, his whole thing was like, you can be mad at your parents, but like, it's part of your story, essentially. I have a hard time with that in cases of like abuse, like really horrific abuse, sexual abuse. Like I have a really hard time with that, you know, and I'm very careful. Obviously, I'm not coming to my clients of like, you chose this. Like, no way would I ever say that. I want people to come, like, if they believe that, great. If that's helpful for them, great. I'm never going to be the one to be like, this is the truth and you must believe it. Like, for me personally, it makes sense for me and it helps me. So I subscribe to that belief because I can see how everything that my parents, quote unquote, gave to me through my upbringing, for better or for worse, helped to get me to where I am. It's sort of like I had to go through that shit and I had to be programmed with the things I was programmed with in order to get sick and understand what I needed to heal in order to do what I do. So I can see it as this like kind of cause effect thing. And yeah, that astrologer really was like, yeah, this is like the map of your life. This is the trajectory. This is why these things happen. This is like what it's all about. So that gives me, that helps me. And it also helps me to sort of do what I was just describing, which is that taking it from a cognitive level into action. It helps me feel safe in like surrendering to the journey because I'm like, there's something bigger here. You know, there's a bigger reason for this. Every like reading or thing I've done of that capacity kind of describes the work that I'm doing now and the direction I'm taking it in. So I'm like, there's something to it. And I am just going to surrender to it and keep trusting it and following my intuition with it. So yeah, so that helps me to, like I said, kind of feel safe to like just surrender and go with it. So I think if that's helpful for people, then yeah, like I do see in a lot of people, like I was saying before, like your illness is saying there's something here for you to fulfill. And on that note, you know, again, to go into the woo land, like illness is not a fluke, right? It's almost like part of the journey. It's supposed to happen. It's a stepping stone. It's like sort of like that was the first part of your life, and illness is this marker and saying like now there's this next part of your life, and illness is that pivotal point for you to now enter into that part of your life. And it's not a mistake that it's this like hard, you know, like line in the sand of like, okay, you have to stop. You have to stop because you can't go forward feeling the way you feel unless you're like me and you just override your symptoms for years and then you finally have to stop because you have to. But anyways, yeah, so that's my kind of like bigger picture spiritual perspective on the work that I do.
I love that. Yeah, we're both very into all the woo stuff. So
Yes.
I think every time that we like record an episode like this, me and Rachel always come back to like, no, all of this stuff really is connected. And if you're only looking at your physical health or your mental health or like spiritual health and you're not looking at all of it together, you're like really missing a big piece because it's all connected. And
Yes.
so this just shows that even further.
Totally. Yep. Someone on my podcast, she said to me, which kind of, yeah, just was really impactful. She was like, the work that we have to do as human beings is actually quite simple. You know, like feed yourself, drink water, move your body, sleep, you know, like the basic foundations of health that we know and most ignore or a lot of us ignore, but it's like there's a simple part on the physical plane, you know, and then like obviously on the mental plane of like curating good relationships and, you know, all the things that we kind of know. It's easier said than done for a lot of reasons, but truly like the bigger stuff, right? Like is not ours to worry about, like that spiritual side of things. This was like some like divine messaging she got because she was diagnosed with cancer and was like dying and had this whole, and obviously isn't dead because she was on my podcast. So she had this like divine intervention message come through that was like, just breathe, like do your work, take care of yourself, let go of what you're holding and trust that I've got the rest. And so I think for me, it was like this really, yeah, it just like simplified things where we think healing is so complex and so convoluted and so much. And really it's like the pieces we have are simple in theory, right? Like be yourself, express your emotions, set your boundaries, live your best life, make choices that are in alignment with who you are. And again, yes, that's where some systems of oppression come into play. And also, I think that's part of it of like when there are things that block us, like that becomes part of the work of how do I move my life in a direction that tears these things down or removes these barriers to the best of my ability or whatever that is. So yeah, so I think that's, yes, that simplicity piece, again, it's simple in theory, complex in execution, but I think it's a helpful anchor to say like, I don't have to overthink this. Like, I just have to learn how to take good care of myself and to kind of remove the things that are in the way of me taking good care of myself. And then the rest falls into place from there.
That's really profound. Yeah, this is super
Yeah.
cool. I think what you're doing is so profound. To kind of start to wrap up, is there anything you would tell someone who's kind of at that point, like you said, people usually have to work through layers and get to the point and to start thinking about this kind of approach. But is there anything you think would be helpful for someone who's considering this kind of approach to know?
Yeah. I think that it just starts with curiosity for me. I think that's the word of like the beginning of this path of like, can you just be willing to be curious about what your illness might be communicating to you? Because if we think of symptoms or illness as a communication, then that curiosity just kind of starts to open that pathway of communication. If we're saying like, oh, I hate my illness, screw this illness, like I just want it to be quiet and how do I get rid of it? That's not communication, right? That's a one-sided voice coming forward and the other side is saying, nope, be quiet. So curiosity is like that. It's not saying you have to like it. And it's definitely not saying you have to like want it or whatever. None of that, because that's that both end of acceptance. You can accept your feelings. And can you just start to be curious of like, what if there was more to this? Like, what if this was a communication? What if my body truly actually is working on my behalf, even by producing this illness? It is doing this not for me, because I hate that phrase actually, but it's doing this like because it's doing its best with what it's holding. And therefore it's holding something for me. It's been doing something for me. And what if I just started to get curious about like, what if this means my body can't hold it anymore and it's asking me to start to consider, can I put it out of a job and take over? What does that mean? What does that look like? So I think, yeah, it's just this like, can you start to be curious and be willing and open that door a little bit? A more maybe radical first step, something I posted about a while ago, was about this idea of gratitude and saying thank you to your body. Even if you don't feel that way, just like what happens if you say thank you to your symptoms? Like, thank you for holding this for me. Thanks for holding for me what I'm not ready to hold. Thanks for processing for me what I'm not ready to process. What does that do? It's just sort of like throwing a little bit of a cog into the wheel of your typical way of relating to your illness that can start to open the door. And then if that starts to feel, like if things start to shift or you start to feel more curious, or if that feels exciting or whatever, then yeah, you can take the next steps into figuring out like, okay, do I want to start doing somatic work? Do I want to you don't even have to like hire someone like me. You can start to literally just sit with your body, do what I said, like start to go to where that symptom is in your body, describe it to yourself, feel it, like how big is it? Where is it taking up space in my body? What happens to me emotionally, like, and just physically when I tune into that? Like, do I get really tense? Do I start to feel really sad? Like, just try to be open and just notice, just be with what's there. And then just start to talk to it like, hi, I'm here. Sorry that I haven't been, like I didn't know that you were something other than just shitty, essentially. And like, just starting to be like that, just like opening that door of like, I'm here, and not having expectations, because that can start to get in the way too. When our brain is like, okay, what's it saying? It's just like, just be with it. No expectations. And sometimes things can start to shift just from there. So yeah, curiosity. And then if that feels good, starting to move into just being with it, letting it know that you're here and you're listening, and seeing where it takes you from there.
Yeah.
I love that.
So, what are some of the different ways that people can work with you?
Yeah. So I am stopping actually one-on-one work in July. So that's right now, it's April 2026. And so July 2026, at the beginning of the month, I'm going to stop working with clients because I'm moving into training practitioners to do this work. There's been a really big, I guess, interest in this work. And I just recognize, because people are like, who can I work with? Like, if our schedules don't work out or whatever, they want to know who else they can work with. And as far as I know, I mean, there's other people doing somatic work for sure, but like this seems different. So I will be training practitioners. So that's anyone who has basically a client base, like if you are working with clients in any sort of therapeutic capacity, whether you're a doctor or a therapist or a body worker, etc. I will be teaching folks how to do this work probably starting in September. Is my goal to launch it in September of 2026. If you do want to do one-on-one work with me, I am available until July. I have very limited space, but I offer like one-off sessions, which can be really helpful to. The goal of those sessions is to, like I was saying before, just get that like specific message. Like, what's the specific message your illness is holding? And then I give you kind of the tools and resources you need to then take it and go with it. So I don't want to be like, okay, good luck. Like I give you things to actually work with it from there. So again, if you're listening to this before July, then you can check me out on my website and book that session. And otherwise, I have, my Instagram, I have a Substack. My goal is to also put free content out to help people. Because again, you don't always need a person. I think having a guide is helpful. I like working with people. But if people don't want to or don't need to, my goal is to also make this work really accessible for folks. So my Instagram is my most active, I would say, social platform. So also I have a virtual community. So actually that's a really good way for people to work with me if finances don't allow for one-on-one, or if, I'm not doing one-on-one anymore. The community is a place where I mapped out my whole healing journey and I put it into something I called the Sacred Illness Blueprint. And that's what I guide people through in my one-on-one sessions, but it's also just kind of also a self-paced course for people who want to. So that's inside the community. So it's a 9-module course journey, guides you through this mind-body healing process, helps you understand what your body is holding. The community is priced purposefully to be affordable. And there's a community aspect if you want, but really most people are there just to do that course at a self-paced pace. And there's other resources on there as well to help support and supplement the healing journey. So yeah, so that is a good option for people who are really interested in this and maybe don't want to do one-on-one, or just, want to kind of get curious about this and they're not ready to commit to anything deeper. This is a good place to get your feet wet and kind of start from there.
Okay, awesome. And we will leave all of that information in the show notes below. Also, what is the name of your podcast in case people want to listen?
Yeah, it's called the Sacred Illness Podcast. And right now it's very heavily focused on just interviewing people who have walked this kind of healing journey. So it's just, my goal is to inspire people to see what's possible when you have this different relationship with illness. Yeah. So it's on my Substacks and Apple and Spotify.
Okay, awesome. We will put all of that below. Rachel, do you have any other questions?
No, just thank you for being here. I think this is so neat to talk about this. And I feel like we're in this era of people getting really interested in this kind of healing. So I think it's great that you're offering this and that you're going to be training people.
Thank you so much. Yeah, thank you guys for having me on. I love talking about this, especially people who are in this like kind of world and mindset and open to all aspects of it, even the more woo stuff. Like I very much appreciate that too, because I think it's, I agree. Like I feel like the world is shifting, or like we're ready for something different. We know the old way, it doesn't work, to an extent. Obviously there's a time and a place, but I think it's more so about what you guys were saying about like empowerment, like our bodies don't fail. They're responding to something. And I'm grateful for any opportunity I have to share this. So thank you so much for having me on today.
Yeah. All right. Thank you. All right. Thanks everyone for listening.
Yep. We'll catch you in the next episode.
Thanks for joining us for another weekly reset. If you loved hanging out with us today, subscribe so you never miss an episode, and share this with a friend who could use a little calm and connection too.
This show is for education and inspiration, not medical advice. To learn more or connect with us, check out the show notes below. Until next time, take care of your mind, your body, and your heart.